Hello, everybody. This is your friendly neighborhood ESL and accent reduction tutor, David Berlin. Now, I have a lot of students who are nurses and who are student nurses, and they're going to nursing school, or they're in nursing school, and some of them speak more English than others. And one of them last night asked me, how do I speak about health in general in a way that Americans will understand? And I gave her a few phrases. So here's the first one. You can repeat after me. Repeat after me. Health is the most important thing. Health is the most important thing. Now, in America, it's kind of a cultural thing, right? We kind of have a belief in America. I don't know how it is other places. Someday, God willing, I'll see other places, and I will gird myself, and I'll get on an airplane, and I'll go somewhere else. But right now, I'm afraid to fly on an airplane, so I've been to Canada, but that's it, okay? So I haven't been out of the country. So I don't know how you speak about health culturally, what your cultural beliefs are about good physical health. I only know what it is in America. I don't know how it is in other places. But here, this is a good way to speak if you are a nursing student, right? And you're speaking to a patient or what have you, and the patient is American. A good thing to say, or a good general way to speak about it, is to say things like, if you have your health, you have everything you need. That is a kind of a cultural thing here. Repeat. If you have your health, you have everything you need. Repeat. If you have your health, you have everything you need. The cultural thing here is one of our cultural ideas. Don't worry about whether it's specifically true for everybody. It's just a cultural idea. It's a way that we see ourselves in America. One of our notions about ourselves is that if you work hard, you can achieve your dreams. So we say that if you have your health, everything else you can figure out, right? If you have your health and you have no home, you can figure out a way to find a home. You can figure out a place to sleep. If you have your health and you have no car, you can figure out how to get somewhere, ride a bus or whatever. But the most important thing to have, even above money, is to have your health. Because if you have your health, we believe, American, in a cultural American type of thing, we believe that if you have your health, everything else you can create, right? Everything else you can make for yourself. But your health is not, you can't just will yourself to be healthy. It's really how we see it. So here's something you can say. If you have your health, you have everything you need. Repeat. If you have your health, you have everything you need. So if you are a nursing student or going into nursing or working on med school, that's another thing you could say. If you had an American patient, or you're a resident, you're seeing American patients, people raised in America, that's something that you can say that makes them comfortable. You understand? People are comfortable when a doctor says things like that, or a nurse, right? It's a good thing to say in a medical situation. And also, you would only say it if the person was improving. You wouldn't say it to somebody who was fading, you understand, or declining. You say it to someone who is improving. I'll give you another expression. If you have your health, you have everything you need to make it. Repeat. If you have your health, you have everything you need to make it. Repeat. If you have your health, you have everything you need to make it. Okay. Now, this was a contribution by the student I was teaching when I asked her to come up with her own thing in English, right? She said, health is the number one thing. Repeat. Health is the number one thing. Okay? This is your friendly neighborhood ESL and accent reduction tutor signing off. Goodbye.